Growing up, I had a very conflicted, I guess, parallels in my world where I had a family that were really proud of our culture, very strong in culture. But everywhere else I would step into as a child, my cultural identity was seen negatively.
Welcome to Future Fit Leadership, a podcast for emerging, experienced and executive leaders to build community, grow capability and future focus their career pathways. There has been a global shift in how we lead, and our conversations with leaders and executives explores the skills, strategies and mindsets that is needed to thrive in this ever-evolving landscape of the future. So whether you are a seasoned executive, an aspiring leader, or simply curious about the future of leadership, we are here to give you practical insights to unlock your potential, change the status quo, and break open our assumptions on how work works. Produced in partnership with Future Leadership, a capability ecosystem for boards and executives, Future Fit Leadership is your place for bite-sized learning for executives hungry to make a change. Hello and welcome to Future Fit Leadership. I'm your host, Sadhna Smiles, and I hope wherever you are listening to this podcast, you are well. Today, we're having a conversation that sits at the intersection of leadership, culture, health, and advocacy. And at the heart of it is an extraordinary woman, Dr. Ngaree Blow. Dr. Blow is a Yorta woman, a public health physician, an academic, and an advocate for Indigenous health equity. She is someone who walks between worlds, honouring her deep cultural heritage while navigating the structures of a health system that wasn't built for her or her people. And she's doing more than just navigating it, she is actively reshaping it. Ngaree has held roles at the highest levels of public health, from working on the COVID-19 response in Victoria to leading First Nations health education at the University of Melbourne. She's a board member of the Australian Indigenous Doctors Association, a global fellow with International Women's Forum, and the founder of It's a Mob Thing, a groundbreaking initiative that's about mobilising community, celebrating identity, and making healthcare accessible in a way that actually resonates with young Indigenous Australians. But beyond the accolades and leadership titles, her story is one of resilience. Growing up, she was raised with a strong sense of culture, learning traditional medicines, songs, and practices from her family. But outside of her home, she experienced the reality of being First Nations in a country where racism and systemic barriers made it clear that she didn't quite fit into the mould that the institutions expected. Instead of retreating, she took up space. She pursued medicine in a field where there were very few Indigenous doctors. She fought for culturally safe healthcare when mainstream systems ignored it. And she built a career that bridges traditional Indigenous knowledge with Western medical practices. Because as she rightly says, these two worlds don't need to compete. They can and should work together. Today, we're going to talk about leadership in the health sector, the need to decolonise medicine and how allies can do more than just stand on the sidelines. We'll also hear about It's a Mob Thing and how a music festival can be a powerful vehicle for health education. So whether you're tuning in as a leader, a health professional, or someone looking to understand what real change looks like, you will not want to miss this inspirational conversation. Hello, Ngaree, and welcome to Future Fit Leadership. How are you today?
I'm great. Thanks for having me.
I'm really excited with this conversation with you. You have such an amazing background and story, particularly in the medical world. But I do want to start firstly with your identity as a First Nations woman. Can you share with me what it was like growing up and how the cultural background shaped who you are today?
Yeah, I'm very happy to. And first of all, I also acknowledge where I'm connecting in from because that's a really important part of protocol for me. So I'm on Wurundjeri Woiwurrung country. So I acknowledge the elders here and pay my respects to the ancestors for keeping me safe on country. I am a guest to this place, so I acknowledge, all the work and the efforts of these communities that have allowed me to be on this country. I have grown up most of my life on Wurundjeri land, which is in Naarm, also known as Melbourne. But I now currently live on Yagara and Turrbal lands up in Brisbane or Mugginjin. And I am traditionally from both Yorta Yorta nations from my mother's side and Quandamooka Nation on my father's side, which is a beautiful island, which is in my background,
Yes.
which is where my dad's people are from. And we're also connected further up Queensland to Barangaroo country, which is around Bundaberg area as well. So a beautiful mix of cultures that I've been brought up with and have informed who I am and culturally, but also who I am professionally as well, because I bring a lot of my cultural teachings into what I do in my work. And I certainly am not the leader on my own. I'm definitely the work of my ancestors and of my family and my community that have supported me throughout my journey. I would not be where I am without them. So I have to acknowledge them as much as I can.
It's a beautiful acknowledgement. Just a quick sort of segue. I'm an island girl as well. I was born in Fiji, but my grandparents came there as slaves, and I often say that, first of all, I stand on their shoulders because of what they did for me to be here today, myself, and they, for the grace of God, go I. So I very much understand your acknowledgement there. Going on from that, I'm a migrant to this country, and I think one of the things that a lot of people from diverse backgrounds struggle with or have to balance is the balancing of the two worlds. And you've had to do that as well, where you've got your own identity, which you're clearly really steeped and very close in. But then also you've got the cultural Australian identity as well. And quite often the systems aren't designed for us to be both. How did you navigate that?
Oh, look, it's a bit of a tricky question because I don't think I did navigate it well as a child because growing up, I had a very conflicted, I guess, parallels in my world where I had a family that were really proud of our culture, very strong in culture. Our mum and dad gave us all language names, so we understood our language and we understood who we are, being taught about our traditional plants, our traditional medicines, about our way of living through song and dance as a very proud part of who we are. But everywhere else I would step into as a child, my cultural identity was seen negatively. I would say that has definitely changed now in society. But I mean, I grew up in the 90s and that was a very strong view. And I experienced quite a lot of racism. I would say I had the privilege of having fairer skin. I definitely saw harsher racism for my brothers who had darker skin than me. And but it didn't really matter about skin color. Once you talked about your cultural identity, it still got a lot of, well, I experienced a lot of backlash. So I definitely had kind of two parallels in that what I was seeing at home with my family, with my broader community, going to Aboriginal community events. I saw a lot of pride, a lot of, staunch people who were activists and advocates. And then I would go into what I would consider white spaces because I grew up in a very non-diverse area. I saw a lot of negative views and very different views to how I experience life, very individualistic, whereas I grew up very community minded, as I'm sure you'll understand as well. So yeah, I think navigating it was tricky, definitely. And kind of is the reason why I ended up down the health pathway though. And a big part of that was seeing how my family had worked as advocates in the space of health. And I wanted to sort of contribute to that and continue that work. So yeah, I wouldn't say I navigated it well, but I navigated it as best as I could, and I did that through the support and of my family, really.
Mm. It's interesting you chose the health part, and you've just shared some of the reasons why. How challenging was it? It's the old saying, you can't be what you can't see, and we don't see a lot of First Nations people in medicine. So how challenging was it to step into a world where there probably was virtually no one who looked like you?
Yeah, it was definitely my community definitely didn't always very proud, but didn't particularly understand why I wanted to move into that space. The history of healthcare in what we call Australia now was quite a negative experience for our communities. And we have our own healing and our
Mm.
own healers that practice medicine quite differently to how it's taught in the university. But also, how it is taught in the university doesn't acknowledge that they also got a lot of that knowledge from Indigenous knowledges. So, there was kind of, there wasn't really a lot of people in this space who were doing this. There were a few, there are a few Aboriginal doctors who started the Australian Indigenous Doctors Association and were some of the role models I look up to, but there weren't many in Victoria where I was training. And it was very challenging. I definitely stepped into medicine not really understanding what medicine was from a colonial perspective. And it was a really steep learning curve and quite a challenge when I first started. And also when I started, there wasn't any sort of entry pathways or supports for Indigenous university students. So I definitely had to build my own networks, and I had to seek out those people that I saw as role models. And they weren't necessarily First Nations people. They were people that had the same passions and drive that I do about supporting your community, doing what's right in the social justice space, and also, just embracing how your culture is a strength in these spaces. So, there were people like Misty Jenkins, who I really admired, who is a scientist. She currently does work on brain cancer. She's a Gunditjmara woman, and she studied over in Oxford, I believe, and was one of those real drivers and forces of resilience that I looked up to. So there were people like that, and they were also just really kind people who could see, how passionate I was in this space. So they're all the people I seeked out. I definitely had to seek them out though.
How important is it then to have sponsors and people who will open the door when you are the first or of a few of you? How important is it for allies to open up doors for you?
Yeah, it is really important to have allies who can contribute things that you definitely are not able to. So it was important for me to be able to access scholarships to pay for my tuition at the university, to help me to live on campus when I lived at home with 7 other siblings and it wasn't quite the environment to study. But at the same time, allies also need to be aware of reciprocity, and that even though you are giving something, this is not a handout or a hand, it's...
Don't expect something in return.
Well, also acknowledging what you're getting in return by giving out that, scholarship or whatever it may be, you're contributing to a bigger vision of supporting First Nations people nationally or across the continent, just supporting this one student going through. Because for us, it's not about us. It's not an individualistic goal or aspiration. It is about how we can then influence and affect things to create change for the broader community.
I want to ask you some stuff around the medical field, which frustrates me. So I'm really, really keen to get your opinion on this. Like, I find that so I'm an Indian woman, so, I'd be, rated as Asian when I go and see a doctor, as an example, right? But what I find is when I go in for basic medical tests or health tests or, more serious ones, I'm measured against a benchmark that is not identified in my culture or my people. So I almost have to fit the standard white norm that it is being measured against. And I find that really frustrating. And I just wonder, how far are we from changes coming through where, if I'm going in for a diabetes test, as an example, I'm going to be measured against, other Indian standards or benchmarks rather than the standard white benchmark that has come from somewhere. Do you know what I'm talking about? Like, what are your thoughts on that?
I completely agree. And I have so many thoughts about that.
Go for it.
My specialty is public health medicine, and a lot of people don't understand what that means. But essentially, my specialty is all about prevention, and it's also about population health. Population health has its positives and negatives in that we are comparing to a certain population, and we should never generalize as a whole, because every patient is individual, has their own unique needs. But at the same time, if you have the appropriate population, you can tailor a treatment plan or a management around illness that is appropriate for that population. So I am very passionate about having the right comparisons in order to give the best practice care. The issue is with current healthcare systems is they have been built on a colonial model. They have been built to tailor the majority, which is white, Anglo-Saxon men, heterosexual, all the other sort of majority norms. And that's proven in lots of evidence. We look at the symptoms for a heart attack and we know that they're not appropriate for women because all of that research has been done on men predominantly. We don't know culturally if it's appropriate or not either, but nobody's done the research in that. But we know for sure women don't tend to experience the chest pain and, the effects on your arm. They tend to experience it in their back. There's a whole bunch of research to show that our comparative markers are based on this colonial model, which means that people don't get the best practice care, even though that might be written as best practice in the guidelines. So the only way we can tackle that is we need more health professionals to be really critical of the evidence that we're getting and make sure that it is appropriate for the population or the person that we have in front of us. And the same thing comes with First Nations health. There's so many deficit-based models in First Nations health where we're compared to markers of chronic disease that may not necessarily be tailored to the right population. So to give you one example, you hear a lot about rheumatic heart disease being quite high and prevalent in Indigenous Australians. That is only in the north part of Australia. So that is only in Northern Territory, Northern Queensland, Northern WA, somewhat also in Alice Springs and the middle of the country. But for Victoria, those rates are not necessarily higher. They are not higher. So it's not a specific issue for a Victorian population. But in saying that, there still may be a prevalence of rheumatic heart disease. And if the patient has those risk factors, you would obviously make sure that they're getting the right tests and treatment for that. But the fact that we're just sort of having this blanket view that rheumatic heart disease is an issue for all First Nations people doesn't make sense because it's not genetic. It's to do social determinants of health. And so we have to make sure that we're appropriately assessing the right social determinants and the right cultural factors for communities so that we're giving the best care.
I'd love to get your thoughts on bringing Indigenous or First Nations medicines into the modern world. So, again, I'll use my own example where growing up in Fiji and I do a lot of medical work back home in Fiji, and if you get sick in a village, they're going to defer to village medicine first before they come to get the modern medicine. I actually believe there's a world that both can play a role in. I don't know how we achieve that, but I think there is but if I went to a doctor in Australia and said, I've got this drink that my mother made me drink when I was 5 years old and it worked magic and I'm doing that, they'd probably look at me and think I was a bit mad. But how do we fit cultural medicines into the modern day world and have the medical field actually see that as acceptable?
I think you have to go back to the definitions of Indigenous medicine because people have a concept that Indigenous or traditional medicines is a specific plant or a specific way of doing medicine. But actually, if you look at the broader context of what traditional or Indigenous medicine is, we're already doing it in our current healthcare systems. So I see it in three ways. I see there are definitely plant medicines. I use plant medicines that I've been taught by my elders and by my dad that's been passed down. So I do see plant medicines. There's also spiritual healing where we have spiritual healers, different names all over the country. One of them that is being utilized in hospitals are the Ngaree traditional healers that are being used in hospitals in Adelaide. So there's two types. And then there's the third type of healing, which is understanding the concepts of holistic healthcare and connection to country. Because we are currently using that a lot in healthcare and we're seeing really good results. So when we start to use holistic understandings of healthcare, so being connected to your country, being connected to your community, being connected to your culture, being able to speak your language, being able to practice your song, your dance, your traditions holistically, then we see better health outcomes. And we see that done really well in Aboriginal community-controlled health organisations. And in certain programs in mainstream services, where they're actually actively ensuring that they're considering the social emotional wellbeing framework that Aboriginal people use when we talk about healthcare. So, and the other aspect of this is the current medicines that we are prescribing patients also come from Indigenous knowledges. And even though there may not be specific written evidence of that, there's so much oral evidence around that. That's the one that's harder to prove because it's not written down. But we know that a lot of the medicines we use come from plants. We know that where penicillin came from. We know where opioids came from. We know that a lot of medicines come from Indigenous peoples all over the world, but they don't necessarily, Indigenous health doesn't have to be a plant. It can be all of those aspects. And if we do use that, we see better results.
Mm. And also, if we bring it into mainstream hospitals and care, then people, particularly First Nations people, will be much more comfortable going into mainstream hospitals rather than not going at all.
Yeah, and I think we are definitely seeing it in, ATROs are part of the main care system. They are only part of the primary healthcare system, so general practice and primary care services. In terms of tertiary care in hospitals, we may not necessarily be seeing an ATRO model in a hospital, but we are seeing, Aboriginal health practitioners being used in hospitals. We are seeing Aboriginal liaison officers. We are seeing certain programs like the Koori maternity services, which are specifically for Victorian and New South Wales Aboriginal communities to access for maternity in hospitals. We are seeing some of these Aboriginal healthcare approaches being used in mainstream services, and they are being used more because they are in those services. So it is happening, but there's definitely room for it to.
There's room for more. Yeah. Yeah. One of your biggest initiatives has been It's a Mob Thing. Tell us more about that.
Obviously, my passion is prevention, and part of prevention is health promotion. And health promotion can be a tricky area because often what we're trying to promote in healthcare, illnesses or diseases that we have not got yet. So a lot of us, especially young people, young adults, they feel healthy and they don't feel the need to go to a doctor to do these sort of checkups or this screening for certain illnesses later in life. But we also know that if we are doing the screening early and capturing the early signs and symptoms of diseases, we have a much better chance of improving health outcomes, especially when it comes to cancers. This is why we have pap smears. This is why we have, other screenings around certain cancers, bowel cancers, other things, and also those screenings around heart disease and diabetes. But in terms of young people, I suppose we have this sort of bracket where people are feeling healthy. They're not going to kind of go to a doctor's clinic for screening, but these people are also looking for the health information. And we can see that because we see the young people getting the health advice from TikTok. We see young people looking for online resources for health advice. So during the pandemic, I was working as one of the medical officers on the vaccine program, and there was a lot of misconceptions around the vaccine. A lot of young people were not doing the vaccine. So during that time, we were looking at other ways to promote the vaccine. Also, part of that is we had just had a long lockdown, and so a lot of people weren't doing your basic healthcare checkups. So essentially, I came up with a concept around running a music festival where we had health promotion around not just vaccines, but everything around prevention, screening, mental health, all the things that kind of get left off or at the bottom
list. Yeah.
This wasn't a new concept because a lot of our festivals would tend to have representation of the health services and things like that. But I guess it was just a way to kind of bring everything together and to do it in partnership with the local Aboriginal health service and just sort of hero those people who are working in those services. And I guess a way for community to see what was happening in those services. So essentially, we partnered with different health services, but this year we're partnering with Wathaurong Co-op, which is the health service in Geelong. And we've worked with them to bring a music festival to Geelong to work. And we've got a bunch of health promotion at that event. And it's also, we've got different activities for the kids to do. We've also got workshops we're running for young adults. around mental health and other sort of issues that are really prevalent in that age group. And it's really just about bringing community together and talking about health without sitting in a GP clinic, you know?
Mm. And that's
Um,
on the 15th of March, isn't it, in Geelong? Yeah, yeah.
Yeah, and we have tickets online. They're $15. Kids under 10 are free. Tickets are free for anyone who is Aboriginal and Torres Strait Islander, but it's open for anyone to come along. It's about celebrating our culture as well and our artists, because we have amazing Aboriginal performers, Aboriginal and Torres Strait Islander. And it's also going to be in the new cultural centre that Wathaurong have just acquired called Bullen Bullen. So there'll be kangaroos and emus there as well, and a few other activities.
Oh, sounds like fun. I'll be in Bali, so I can't come, unfortunately. Otherwise, I would have made the time to come and actually come attend the festival. You mentioned COVID. I'm interested to know your opinion on how we managed COVID in that time, particularly from a First Nations perspective.
Well, it's interesting because there was quite a lot written about this at the time. You know, the pandemic response was a brand new approach, something that we hadn't really experienced. It was something we didn't really have structures in place for. These were created on the go, essentially. But how they were created was based on previous scenarios. And what the Aboriginal community did really well is the leaders in Aboriginal health, so the peak bodies for healthcare, the Aboriginal health services, they actually came to government and said, we know how to look after our communities. We've been through this before. Tell us what's going on and let us get involved. And because of that, it was actually set up really well for First Nations communities. And we actually had really low prevalence of COVID for First Nations. And actually, we were seeing higher levels for other communities that were affected quite a lot by the social determinants of health. They're communities that I call priority communities. I don't like the term vulnerable because these communities aren't vulnerable. They're essentially just more likely to experience social determinants of health, which make it harder to avoid, I guess, getting the infection and accessing vaccinations or other care. So we actually used a First Nations approach with other priority communities like refugee communities or migrants who had recently come and spoke English as a second language, because a lot of the health promotion was in English. It was actually the First Nations people who were leading the way and were the ones in the communities who were actively supporting other communities during the pandemic. So I actually think that that process was run really well because of our leaders in Aboriginal health.
What are you working on at the moment? What are some of the key projects you're working on at the moment?
Oh, there's lots going on. I mean, I'm still very passionate about the health promotion, which is why we're working on the festivals, and we want to see those festivals expand to other communities outside of Victoria and also potentially internationally. I've had some conversations with First Nations communities in Canada who also see this as a really great initiative to do over there. The other area that there's been a real push for a change in is in rainbow mob health. So LGBTIQA communities that are also Aboriginal and Torres Strait Islander. There's been a lot of support to see better healthcare and better training in this space. So I've been working closely with the Victorian Aboriginal Community Controlled Health Organisation to help set up a training program for health professionals so that they have more understanding around rainbow mob health needs. And also continuing to do the education for medical students so that we are seeing our future doctor workforce as really competent and culturally safe when it comes to First Nations health, because we know that a lot of the reasons behind the inequities for our communities is because there's a lot of ignorance around our communities and what our healthcare systems and how they are not really tailored towards our communities. So there's some of the things I'm working on. Yeah, there's lots of things sort of we can do, and I'm always very passionate to find new projects and people to work with who have the same drive and passion that I do.
I'm just looking at my notes here because I wanted to get this number right. But you are one of only about 500 First Nations doctors in Australia. Is that correct?
Yeah, I don't
How do,
know the numbers, but yeah, it's around 500 or 600.
yeah. How do we get more? How do we get more of you around the table?
Yeah. Well, this is something that the national body is working on. I am a member of the Australian Indigenous Doctors Association and I'm a previous board member. I know it's a real drive to have a bigger workforce, but another big part of it is just training current doctors to be able to work also safely with our communities, because the fact is we are still only about 3.5% of the population, and we're definitely more than 3% of the healthcare system. So we can't do it alone. But in saying that, I'm seeing nearly double or triple the numbers of Aboriginal and Torres Strait Islander medical students now than when I was a medical student. So I'm really proud of how far we've come. I'm also really proud of the fact that medical students, Aboriginal and Torres Strait Islander medical students, aren't just there to be doctors, but they're also bringing beautiful cultural perspectives into healthcare that are benefiting all patients. Yeah, I'm pretty excited about our future and and I guess the workforce and the numbers that we have coming through.
Given the challenges that you went through yourself, where there was, very few when you came through, what would be your piece of advice or, just advice generally for young First Nations men and women going through the same career path that you have?
Yeah, just find your people. Find those people who have the same vision and drive as you, because medicine is a very hard journey. It's not just medical school, but it is a system that's built up for the wealthy. It's built up for people of a certain class and privilege. And there are things you have to navigate as a doctor, even after you've finished medical school. And the only way I've been able to do that is I've created a network around me, not just my own community and the people in my family that support me, but I've found those role model doctors that I look up to and can see how much change they're making and the impact they're having. And I seek them out to learn from them. So I really encourage young people coming through to do that as well. And it might not necessarily be young people too, I should say. I've seen a lot of amazing mature age students who have chosen this as a second career and are doing amazing things as well. Mm-hmm. So just any of our community coming through, they're going to make a huge change to the way healthcare is in our country, not just for First Nations people, but I think for all people.
Mm. If you could, or collectively, you could change one or two things in the healthcare system right now, what would it be?
There are lots of things that could be changed. Personally, in the same way that we have ACHOs in primary care, I'd love to see a First Nations driven and led tertiary centre. So a hospital system that is absolutely built from the start and all the way through, that has First Nations ways of doing things and of seeing health. And I think that would be an amazing centre if that was a possibility. In the current healthcare systems, I would just like to see a lot more mandatory training. I think the online stuff that they give doctors and other healthcare professionals isn't good enough. And I think that there needs to be a lot better, more comprehensive, tailored training about First Nations health at every healthcare setting. And I think there should be also accountability, a lot more accountability when doctors and other healthcare professionals are unsafe culturally, because we are not seeing accountability in some cases. And we are also still seeing very high rates of deaths in custody, which overlaps in the healthcare system a lot, because a lot of these people who are in custody do go to healthcare services for support and aren't given that support. And we've seen many, unfortunately, cases of that. So there's some of the things. I would also like to see a lot more just embracing First Nations culture, a lot more people involved in things like NAIDOC Week, it is a week of celebration for First Nations community, but we never really see allies involved in NAIDOC. We see them involved in Reconciliation Week when it's about sort of reconciling, but also how about we celebrate, and we see more people celebrating our cultures and how diverse and beautiful and strong all of our First Nations cultures are, because there are over 250 different nations. I'm only part of 3 of them. And I've only have lived experience of living on a few different countries. There's a lot of beauty, strength, and knowledge that comes from our communities. And I feel like I'd love to see that embraced a lot more.
The second part to my question was going to be, what more can allies do? Apart from that one thing, is there anything else that allies can do?
I think just being really curious and looking into ways to broaden your views and understandings of First Nations people in general. I mean, that means actively looking for movies, books, events that are First Nations led, looking up articles that are written by First Nations people. There's so many beautiful artists in our community, not just musically, but in the theatre space, through a lot of the media. We have amazing TV programs on NITV. There are so many avenues to find out more and get a broader appreciation of First Nations communities that I think allies don't often try and seek out. Instead, they just look for First Nations people to talk to. And we can't be around everywhere
No.
giving advice and inviting them into spaces. We also need people to actively look for those spaces and look for ways to be involved. And also, whatever you're involved in, just reframing, I guess, how you run things to maybe look at ways that you can include First Nations views.
Mm.
Every organization has a set of values and has I guess, an organizational approach, but how could that potentially be looked at in a way that is in keeping with First Nations knowledges and could incorporate First Nations businesses or other avenues to bring in First Nations culture?
I want to segue a little bit and talk about you, because you were selected for the International Women's Forum Fellowship, IWF, and a wonderful opportunity for you. What has that experience been like?
Wow, it was an incredible experience. We, over nearly a year, we learnt from amazing leaders all over the world who have really made a lot of change and been change makers and a lot of impact in their different areas. I guess part of that fellowship, we went over to the US. We met with a lot of other members of the IWF who are all women who have, I guess, made huge changes for their communities and for the places that they live in. And then we also were taken over to INSEAD in France, and we did part of a business course there around leadership. And then we finished the program at Harvard Business School and learnt from some of the best at Harvard about leadership. But I think the biggest takeaway was the women that I got to do this experience with. And I had such an incredible time sort of getting to know these women. I would say a lot were from the US and Canada, but we also had women from Mexico, from Ukraine, from Pakistan, from the Bahamas, Trinidad, Tobago. There was, yeah, quite a lot of diversity in the countries that were represented. I was the only representation of Australia, and proud to say the first Indigenous Australian to be part of.
Congratulations. Amazing.
But we learnt so much off each other. And
Mm.
some of these women were CEOs of huge companies. Some were, one was one of the launch directors at NASA. Some of the women had set up their own NGOs in their own communities. It's an amazing woman who has set up an NGO to support families in the US who are sort of escaping domestic violence, and also to support families to practice their culture as well. Just, I guess, what I learned from them was just incredible, and they'll be lifelong friends that I will keep. So I had a really great experience in that, and it gave me a lot of ideas on how what we're doing for First Nations people here is more than just for our own communities, but other communities look to other, I guess, communities that are changing things, and they're able to sort of adapt that and use that in their own cultural context. So I see that a lot, and I've thought of different ways to look at how I'm doing my work because of how these women have been doing their work. And I hope that that's also been reciprocated.
I'm sure it has.
So that was my biggest takeaway.
Was there anything in particular that you've come back and you've thought about the way you approach leadership that you might change or, add to?
There's so many different things, but there's just been little things on just how to approach the way that you communicate and get messages out. Had a great session where there was a campaign about a very small community on a small island off the coast of the US, and the way that the program was communicated was through VR, where we were using those VR headsets and we were going onto this island through VR, and we were seeing the program that was happening, and we were talking to the people who were doing it because of the interviews and how it felt like you were essentially on the island with them. I thought things like that just gave me different ideas on how you can communicate messages, how you can connect with people in ways that you felt like you couldn't connect with people for, and just the way that we don't have to always think so small-mindedly.
Narrow, yeah.
And that we can use global concepts in our own local context. And that kind of thinking has really got me reimagining the way that we do leadership over here.
And finally, if you could give one piece of advice to emerging Indigenous leaders, whether it's in the public health sector or medicine or advocacy, what would it be?
Just be strong in who you are and who you've been brought up to be by your family and your community. There will always be people in this world that won't see what you're trying to do or how you are supporting your communities, but just be strong in why you're there, and always come back to those reasons and those drivers that got you to the place that you're in. I think that's really important. It's not about whether people like you or whether people, can see what you're doing. As long as the people around you and your family and your community can understand your vision, then, I think that's the most important thing.
Thank you so much for your time. It's been a wonderful conversation with you, and good luck with all your future projects that you're working on, and certainly the event in Geelong. Good luck with that.
Thank you so much. It's been really nice to talk to you.
If you like what you've heard, please share, rate and review this podcast, and don't forget to share it with anyone who might benefit from hearing it. The producer of Future Fit Leadership is Maritza Barone from Guide Your Light Network. If you would like to reach out to me, please DM me on any of my social media platforms. I'm available for speaking at conferences or consulting to your business. Future Fit is created in partnership with Future Leadership, a capability ecosystem for boards and executives. If you'd like to join the community and receive a free takeaway each week, sign up to the Future Exchange app in my show notes. Thank you for having me in your space.
This is a Guide Your Light Network production, creating podcasts with purpose.